Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so discussing the market venue programs, the retail programs that are available to agents that are contracted through Premier Marketing, and a bit of an additional emphasis today on some of the activity that we recommend that you help with in order to make that investment of time and monies that you're putting into those different market venues, making it really pay off for you. There's nothing as disappointing as having set up a dance and paid for the band and nobody comes. So what we're looking to do is not only give you an update on the different programs that are available to you now, but also give you the opportunity to make that part of an overall marketing program and enhance your success this coming AEP. Today's presentation is being recorded, and it, along with different pieces of information that we'll allude to through the course of the presentation, will be sent to all who have RSVP'd for today's broadcast. So be watching for that if you would, because there are a number of attachments. Check your spam filters too. We've discovered that as we send multiple attachments as part of a blind copy e-blast, sometimes that gets pulled into your spam filter. We're happy to send it more than once. It's just that we want to make certain that you have the information in a timely fashion. A bit of background to begin with, for those of you who do not know who Premier Marketing is, if I can get my computer to work here. There we go. Pardon me. We are a national marketing organization that was founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance contracts through independent insurance agents at contracts with the highest possible commission levels, and recruiting contracts are available to those who qualify. As I mentioned, we were founded in 1968, so that means this last year we celebrated a milestone in our history, our 50th anniversary. And that's quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations in conjunction with its contracts through independent agents such as yourself in the Medicare space for both Medicare Advantage and Medicare Supplement programs. We do so through a full insurance portfolio that includes Medicare Advantage and Med Sup programs, but also standalone Part D prescription drug plans, a full portfolio of life insurance and annuities, and final expense life insurance, including pre-need programs. We also offer long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. Those Medicare Advantage carriers are all the national carriers across the country and include many of the smaller regional carriers that are a factor in your success, and in certain cases may actually affect your eligibility for different retail programs. We also offer that same philosophy when it comes to offering standalone prescription drug programs, where the national carriers are available to you and standalone programs as well. The Medicare Supplement portfolio is very large and robust. Even if you're working in a setting such as a Walmart or a CVS or any other type of retail situation, in many circumstances, a diagnosis upon your part is necessary in order to help the person obtain the coverage that might be best for their situation. And in many cases, that includes considering Medicare Supplement programs. It's a very large and robust portfolio, and we offer you tools to help do comparisons and market the programs efficiently as well without cost to you as a contracted agent. The ancillary portfolio is the same philosophy as well. So in each of those crucial categories, you have the national players in that space and an opportunity to make certain that you fill the holes in the coverage, no matter what the base coverage of your prospect or client happens to be. Because that Medicare market, well, it's a huge one, as we always say on these types of presentations. where the baby boomers are aging into the overall market, over 10,000 a day. But that's not a true indication of the depth of the market that we have in this space, and particularly one that you access through the retail programs. There are many people over the age of 65 who continue to work and don't access Medicare immediately, but there's also a sixth of the Medicare population that is under the age of 65 qualify for that coverage because of disability, and so they're part of the market that we need to address as well. It's a varied market where you have folks that have different physical challenges. 2/3 of the population has 3+ chronic conditions. A later poll by Kaiser Family Foundation says that over half the population has 5+. And they're also a bit challenged when it comes to income and assets in many circumstances as well. And that's why you need a varied portfolio of products in order to address the needs of that varied population. It gives you then an opportunity to look at and address the different needs of the people that you visit with, and do so with the information you need in order to help them come up with a good fit between what's going on with their body, what's going on with their wallet, and what's going on in the marketplace as well. Because they have choices. Even when a person comes and picks up medications from a particular pharmacy, they have different ways that they access those drugs. Many folks, if they stayed on traditional Medicare and picked up a Medigap program, they probably picked up that standalone Part D drug coverage. And we need to do an evaluation in order to make certain that that coverage is still their best choice in today's market, because everything is subject to change. Their body, the plan, the formulary, so all kinds of different things come into play. And that same philosophy also exists when you look at medication coverage that's embedded in the Medicare Advantage programs as well. What we're seeing as people age in, according to DEF research, is about an even split between folks turning 65 and selecting either a Medicare Advantage or a Medicare supplement program. And then you still have that portion of the population that remains on original Medicare only. That might be because they have other coverages through retirement programs or through the service to the country, or they may choose to simply self-insure. We need to make certain that we address all the options that are available for our prospects and clients, and we like to do so in a atmosphere where they come to us. And that's a bit of a challenge, certainly in certain markets, and particularly in the retail programs, where it seems like the mantra that comes about in the real estate business, location, 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 makes a big difference for you. And that is true in certain circumstances, where the store is located, where your kiosk is located, where your head is located as well. So let's look at some of the different things that we want to do in order to make this successful in the different programs that are available to us. The first thing we need to do is realize that this is just part of an overall marketing program, and we need to incorporate in different strategies in order to be as successful as possible and in order to take advantage of the opportunity that presents itself. You have a ton of different options. At this point in time, in mid-June of 2019, some of those options may be becoming much more limited, but we're going to go through them and give you some ideas as to where they stand with the opportunities that are available and what we still have available to us as agents looking to fill the holes in our marketing programs for AEP. Keep in mind, some of these give us the opportunity to begin marketing now, and that's part of the philosophy that allows us to basically fill the opportunity in the fall with prospects waiting to speak with us when they have an open election period. So let's go through and look at some of the different carrier opportunities, overall corporate opportunities, and some things that we can do ourselves as independent agents. When we look at Aetna, it's a program that requires Aetna product certification, obviously. They ask for additional training to take place in the retail arena. They have a module and different pieces that they want you to do, live webinars to help you with that as well. They track not only the activity of setting up the events, but also the reporting of those events through their proprietary software system. But you have a great deal of flexibility with this program when it comes to the days and the hours in which you wish to work. Pardon me. And pardon me, I am fighting through a little bit of a head cold here, so there we go. Pardon me. So you have some flexibility as to the hours that are available to you and the days that are available to you. And keep in mind that these requirements may very well vary by market. Some of the national campaigns, the stores are already selected. In other markets, you have opportunities still with different CVS stores across the country. You have that merger, partnership, takeover, however you want to phrase it, between Aetna and CVS. So you have different challenges that come into play. Most markets require at least 10 hours per week. So you have a bit more flexibility in this program when it comes to the investment of your most precious commodity, which is your time. So there are different things that we want to make certain that we have available for you in order to make clear the opportunity in your chosen market. The cost on an overall national campaign, Aetna is asking for a $275 investment with the opportunity for a $100 reimbursement for adherence to the program's qualifications with no marketing incidents, which is considerably less than the 20 hours, half the time of the hours that are put in through the Walmart program, and about, well, a little less than half the cost as well. So it gives you the opportunity to work multiple stores should you choose to do so. But the requirements are a minimum for a per store basis. It also is a program that gives you marketing material that you use if you have one store or multiple stores. You kind of take it with you, have gun will travel, but it is also material that is available to you because you purchase it. It stays with you year round. So this type of marketing support is available for you as you go through, and perhaps as part of your AEP marketing program, you have set up events in senior centers or nutrition sites or other centers of influence. This material can go with you and help you in your presentations outside the retail setting as well. This gives you an indication that Aetna is looking at this as more of a year-round program than just an AEP program. And obviously, outside of AEP, where everyone has an opportunity to change their coverages, during lock-in, you still have a large portion of the Medicare population that might be eligible for a special election period. There are certain days that are blacked out throughout the year in Aetna's retail program. When you look at Anthem and AmeriGroup, this is also a program that is being aggressively pursued and has many stores available in certain markets. It does require Medicare portfolio certification. The shifts are very flexible for you when it comes to the days and times. They are generally Roundy's or Kroger locations. They do not charge for the marketing support for the program. They do ask for 20 hours per week. Kroger also helps in marketing you in your presence in that store. They ask for weekly sales reports, which is reasonable considering some of the others will ask for them daily. And it is a program that begins on the 1st of October. When you look at Baylor Scott and White, this is a program that is generally available. Well, not generally. It's available in Central Texas and some parts of North Texas. It requires Medicare portfolio certification as well. It's very flexible on the days and the times. There's no additional cost to the program, and they work with the certain CVS locations in the state of Texas. When you look at Blue Cross Blue Shield, where the previous slide when we spoke of Anthem and Amerigroup is a different contract than this one. This is the Healthcare Services Corporation contract. It requires the certification for their offerings in the states that are available through this contract. Keep in mind, I emphasize Texas here because I live in Texas, and the world revolves around me. Anyway, 4 other states are part of this contract: New Mexico, Oklahoma, Montana, and the state of Illinois. And this past year, they standardized some of the shifts in order to help publicize, and they were on Tuesdays and Thursdays, and they were in certain Walgreens locations. So this is something that, if it's of interest to you, with Blue Cross Blue Shield, that we work with local management in order to ascertain the depth of the possibilities available for you with Blue Cross Blue Shield in this circumstance. This is kind of a new thrust in the retail arena. Came as a result of one of the calls that we had very recently with Bright Health, and it is more of a do-it-yourself type of situation where they're asking that you market their Medicare portfolio and be fully certified for it, but the details are up to you, including the selection of the site. What they look to do is support that marketing activity that you come up with in a particular market, because they defer to you. They feel that your expertise in your home space probably can surpass a lot of the other challenges that you see with perhaps a neighborhood market, Walmart, that's not as heavily frequented or whatever. But this is something that would be a great opportunity for you, particularly if you realize that there are other pharmacies out there that aren't part of a chain and need help in maintaining their client base and their marketing efforts as well. It's a great way for you then to leverage a new relationship with a carrier that might be new in your area, because Bright is expanding into additional areas where they hadn't had a product this year or in the past. United Healthcare's version of the retail program is a United Healthcare initiative through multiple types of stores, multiple brands of stores. They do, as Aetna does and as many of the other carriers do, participate in the Walmart program, but this is a program that is specific to United Healthcare, utilizes their computer systems where the reports are filed through that system, as are the filings for the activity. They give you the flexibility when it comes to days and hours for activity throughout the week. They're asking for a minimum of 15 hours, and it is directed through the territory agent managers. So the folks that are your normal liaison with this carrier are the ones that help work through access to this program with the different locations that are in your network. At this point in time, much of the United Healthcare store selection has already taken place, but they still continue to look in many markets for folks who wish to share a location with another agent. And then, of course, the program that most people think about when it comes to retail market venue programs is the Walmart campaign. And in 2020, we have a continuation of some of the past efforts that continue with stores throughout the country. There's stores everywhere with Walmart, it appears. These are products that are varied from market to market. They look for a minimum of 2 Medicare carriers, preferably 3, but they require you have multiple certifications and contracts, obviously, in place in order to qualify for a particular store. These are the participating carriers for 2020 through some recent communication that we have received from the Walmart program. And it is one that begins on the 7th of October and goes through December 13th, all the way through. It does have the blackout for the Thanksgiving week, and they do stage regular calls to keep you up to date with progress and different ideas that are working well in certain markets and some of the things that aren't doing nearly as well. Staffing is nearly completed. They're asking agents that have stores already to make certain that their certifications show on their systems by the 10th of September. since the feed between the carriers and their systems can sometimes take up to 2 weeks. This is a program that has you certifying early and often, kind of like we used to vote in the 60s. Vote early and often. This makes certain that you have all the requirements in play by the timeline that this company sets, and this system feeds automatically with your certifications. There have been different circumstances in the past where we've been able to manually adjust some of this, but as you go through and have your certifications come into play, it's an auto feed, and for the most part, over the last couple of years, we've seen very few challenges with the system when it comes to certification notifications. It's also the software that is the place where you go to make certain that your training for the programs is in play as well. Because not only do you need to contract and certify with different carriers, you also need to complete certification within this program in order to move forward as well. It is a program that costs $500 per store, with a possible refund of half that amount, $250 if an agent meets all the qualifications. And that includes the minimum certification of number of carriers, that all events are not only scheduled and completed, but completed on time. That comportment is also a big component of this, where you follow all of the marketing rules. It requires a 3-day minimum within the week, 20-hour minimum activity within a store, and that at least 90% of the reporting mark is completed daily for your scheduled events. So what we've got is an opportunity that has had the third round of activity just recently closed. In conversation with the folks with the Walmart campaign, and over the last few days, the stores for the most part are all already in play, that are going to be in play. Any future involvement with this, if you haven't already gotten into a Walmart and it's something that you were looking to do, it would be a circumstance of sharing a store with another individual. It is one of those things too that it kind of reminds you of, I don't know if anyone on the call today has served in the military, but it's the whole hurry up and wait situation. Antithesis. If you have a store already in play, they want you to begin that relationship building process with key personnel within the store. That includes going in and introducing yourself to the pharmacist and the store manager, and making certain that they realize that you're there to build value for their location and be an asset for that particular store. It also asks that you follow certain guidelines, not only within CMS rules, but with the code of conduct that they have in play for the store as well. They don't want you to be sitting on your phone or your iPad or whatever else. They want to use the technology for within the store to be limited to business purposes, and that you're actively engaged with the store population as you fulfill your hours and days in the store. You also are asked to be attired appropriately, and that you use only marketing materials provided through the program. So while you might be contracted, let's say with Humana or United or Aetna or whomever else it happens to be, and they all have great marketing material, well, there'll be a sales kit and that's it, because most of the rest of it has to be approved by the program itself. So the great pull-up banners that you see with different carriers are not a play in this particular opportunity. We kind of mentioned this a little bit when we talked about Bright a bit earlier. There are different locations, particularly now across the country, where different stores are no longer an option, but there are strong centers of influence within the community that would behoove you to work hand in hand with that location in order to reach your population that you're trending for. Many people do not respond to different types of overt media outreach, letters, radio, TV, whatever it happens to be. But depending upon the location that you select, it might be a circumstance that they will participate simply because that's the location they go to, and they work with that particular location. They participate in that church. It's a senior center that they're part of. So it gives you the opportunity of identifying this particular location, using it as a base of operations, which you do with any of the retail locations. You make that your hub, your office away from your office away from your home, and you direct marketing activity on an overall integrated basis in order to make certain that the foot traffic not only is there, but it's interested and it knows what's going on. In these circumstances, then you have different things that can really be a key indicator for your success. Having identified a location with whatever program it happens to be, and then working thereafter to fulfill the needs that help you be the most successful for that location. For certain carriers, for certain initiatives, that may mean new carriers, or it may be working very closely with a particular carrier in order to garner the support that you need in order to make it successful. So having those contracts in place and being certified and ready to sell is a big deal. And then you practice. It's the old, you don't play a football game on the second day because you got to get in shape. You got to get your plays down, whatever else it happens to be in that tired analogy. You have to train in order to be successful for the game you are about to play. And so we have some different things I think that can be helpful in guiding you along that way. Some additional trainings, well, making certain that you know your product, obviously, is a big piece of it. And that means you start with the certification process. There are changes in AHIP this year over recent past offerings in those trainings. And so you can't just blow through it. You know, I've had a lot of people that have aced the programs in the past, the certifications, that have had challenges in the first or second attempts in passing AHIP. So it's something you need to be aware of and follow all good test taking practices in order to make certain that those certifications come into play. If you work with our organization, we have electronic enrollment through Medicare Center that can be of great help to you. And the carriers are also becoming very adept in those electronic enrollment processes as well. Strongly recommend adhering to them because if you do things electronically, things just roll easier. You don't have to worry about missing a question. You don't have to worry about the quality of your handwriting. Some of you are pretty good at it. Some of you are like me. You write in a language that's not your mother tongue, in a manner of speaking. So we want to make certain that this is a tool that helps you be more successful and be more time efficient as well. Most of the carriers also require that you take a retail module within their training as well. Aetna, United, Humana all do. And it's a piece that it helps not to look at it as a requirement, but as a tool to improve your marketing expertise in that particular location with that particular carrier. There are also different pieces within the tools that are made available by those carriers with that e-support through the Walmart program and the systems that they have into play, or the carrier-specific initiatives where you need to be familiar with that e-support there as well. We're going to spend a bit of time here on grassroots marketing in just a few moments with some hints on how to make that a key part of your success. So we'll breeze over that for the moment. But also having the information at your fingertips that helps you successfully discuss and explain the Extra Help program through low-income subsidy or Medicare savings programs. Knowing how to run quotes, not only on Medicare.gov or Medicare Center, but also on the different software programs that are available to you for Medicare supplement programs. Well, many of the folks that come into a retail setting are at the median income of $26,000 plus and below. You have obviously folks that are on medications that have more monies. And in those circumstances, many times their best choice might be a med sup with a standalone PDP program. Do you know how to make that work and make it a key factor in your success? That can be a huge difference. And part of that comes into play when you know how to work the Medicare.gov system or the Medicare Center programs or the different types of tutorials that are available to you in order to successfully compare one plan versus another. We want to make certain that you have that information for you. And then, of course, this may seem ridiculous, but sometimes we become too good for our own purposes. We forget some of the basics, making certain that we know Medicare and the basics of those programs. A 101 piece that helps you explain the differences between the types of coverages. Many of the carriers have come out with some very nice pieces that help us in that explanation, and we have additional pieces that are available to you from CMS as well, in addition to like the National Council on Aging and other programs that help you compliantly explain the different options that an individual has when it comes into play. And it's important to note too that, hey, we don't put all our eggs in one basket, because just because it worked yesterday doesn't mean it's going to work tomorrow. Some things have a history of success, but let's kind of hedge that bet and use our location as our hub. We know where our particular store is. Let's work out from that store with centers of influence in the community and come up with additional sites that, as we go out and visit with those locations, as to if it's face-to-face or telephonically, make them aware of the service that you're offering at your retail location, that they know that you're available for work within their organization as well. You can multiply on that investment in the retail setting simply by getting out there. I had an old sales manager with Prudential years and years ago that used to be really fond of, even a blind squirrel can find an acorn, but you got to get out there and climb a tree. Well, he was a strange dude, Drew, but there's truth to it. You know, it's the old, you don't get kissed if you don't ask. All these bad analogies I can bring up for you, but that exposure gives you the opportunity to not only visit with more people, but also enhance your confidence and your propinquity. There's a good word. I just love to use that word. You're expanding your influence throughout the community, and you're setting yourself up as a subject matter expert. So how do you find some of these places? Well, which religion you want to work with? We can find ways of finding a place of worship. If you're Christian, churchangel.com will help. It'll lay out some of the things that Google will just spot and play for you where they are. But it gives you an option to go in by zip code and find different locations, including in many circumstances, the contact individual for that particular location, and visit with them. We have different trainings that go about on a regular basis that speaks to working with faith-based organizations, and those will be linked as part of the follow-up to today's presentation as well. It's a great way also of reaching a demographic that you establish that relationship with the senior leadership within that particular church. You have their confidence by the way that you present yourself in the programs and the work that you do. You are vetting yourself for the congregation in many circumstances, and you then are able to work in an atmosphere of trust. Jewish? Well, you can find synagogues as well. Muslim? Well, you can find them too. You can work through just about any religion and roll it out based on location and make that a part of your overall marketing program. Does that mean you have to be Lutheran to work in a Christian organization of Lutheran faith? No, it doesn't matter. As long as you're going out there with the proper intent and you're delivering the proper information, it's all part of the same overall system in order to make certain that you have the information you need to make it successful. You can do the same thing when it comes to nutrition programs for seniors. There are a ton of programs out there that deal with food banks or different nutrition sites that may well act as a way to dispense your information so folks know, hey, I'm at the CVS on Tuesdays and Thursdays from 10 to 2. Come with your information, bring your drugs if you want, and we'll walk through an analysis for you and see if the program that you have this year is going to continue to be your best option moving forward with changes in the programs and changes in your body. So that gives you an opportunity to find those. Food pantries, these are actually a great help to you as well if you work the low income market, a great way to properly market by having your information available. You got to make certain that you do things compliantly within the proper distance from where they're dispensing food going out. But it's a great way for you to get your information into that segment of the community as well. You can find senior centers anywhere. SeniorCenterDirectory.com is a great way to isolate and basically identify these particular locations throughout your chosen market. So this doesn't necessarily have to be the neighborhood that you live in. It's the neighborhood you've chosen to market to, or it's the neighborhood where the best store was available to you in your mind's eye. And you can then identify all these centers of influence by using some of these tools. Same thing when it comes to where we're going to where they, where they worship. Let's go to where they live too. And you can find senior communities, seniorliving.org. Keep in mind, many of these are maintained by organizations that want to sell in their own mind as well. They have an opportunity to live at a particular location, but it's a great way to identify it. And it all depends on your approach as you reach out into the community to these different locations as to how you're received. You work that lower income piece, lowincomehousing.us is a great way to identify those locations as well. So subsidized or HUD housing comes into play. Okay, we've talked about where they worship and where they live. Now, where do they seek care? We can look then for provider partners. They can be doctors that are part of the network of the company that you're working with specifically. We'll talk about that in a second. But an overall greater perspective, because there are many physicians or other providers of care that aren't necessarily on every bloody network, and they still look to deliver the best care to their patients. They still look to maintain their quasi book of business. And this gives you the opportunity to adjust your approach based on how that physician delivers care. How are they reimbursed? They're part of a network, it's a little different animal. If they're not, well, that then gives you the opportunity to bring into play your status as an independent agent with multiple options and multiple types of programs for the people that you work with. You can take that and then go into some of the carrier-specific networks as well. And this is a great way to isolate carriers that are specific to your particular initiative. So if you're working a retail campaign in a CVS for Aetna, well, keep in mind, Aetna is not the only carrier that contracts with CVS for pharmacies. So you have a bit of a play there as well. And you also have to do what is right for your customer. So having that information at your fingertips can be very, very valuable to you. You can do that same thing when it comes to providers of care, when it comes to oral providers of care. Find a dentist. The ADA has a system that enables you to do that same kind of search too, based on zip codes or addresses. And because there are many standalone programs available for folks on a dental basis, this also gives you an opportunity to cross-sell outside of just the base medical coverages. So another way of creating an income stream into your agency, and a way of also creating another way of driving prospects to a visit with you, their soon-to-be agent. There are other centers of influence in the community too that we can look at, and these are what I lovingly refer to as blue hair heaven locations. Certain restaurants have a reputation for a senior clientele. Coffee shops in certain communities are a huge congregation point for our target demographic. There are folks that really, really like to have their hair set on a regular basis. Those types of beauty parlors in a particular location can be a great way of identifying where people go, as is their chosen entertainment, such as bingo halls, a great way to drive additional people to your chosen hub, your location within a retail setting. Restaurants, well, gee, this one, theseniorlist.com, it gives you a list of restaurants that give discounts to the senior population. Now, keep in mind, we no longer can provide a meal during an informational presentation or a sales presentation either, but this is a way that you could go into a different location, use this as a hub as well for perhaps seminar selling or a opportunity to prospect with your flyers, letting the folks know that you are offering complimentary reviews of their medication coverage right down the street at your retail setting. A great way of reaching into the community, even if it's the daughter or son of a beneficiary that's eating and they say, ooh, this is a way that we can get mom or dad's plan reviewed year over year and see what is possibly their best deal moving forward. Because the needs of the many outweigh the needs of the few. If we want to quote Dr. Spock or Mr. Spock in one of the old Star Trek movies, having each of these programs contribute to your overall marketing success compounds the effort. They see you all over, and it helps them then to gain that name recognition and coordinated activity. If you have your own office in the community, you can also have a second address on there. This is where I live and do business. So it's a great way to make certain that the people realize that you are a resource in their community for them to access for information about their health care and their coverages. Keep in mind, too, that the government even gives us some information that can help us. CMS material is available on the Medicare website that speaks to them about parameters that they need to be conscious of when it comes to providing comparisons year over year, and they have it in multiple languages as well. Different tools are available through their national training programs as well that helps you utilize the Medicare Plan Finder. It can be a bit cumbersome in certain markets because, boy, there's 40 some plans in my market. I don't contract with all these carriers. Well, you have another option available in our Medicare Center program that we'll talk about as well. But this is a great way for you to gather the information you need to be a true asset to the folks that you're visiting with. And obviously, depending upon the type of program that you have and that you're involved in, if you're working in a Walmart and you're contracted in that particular area, just pulling them out, not specifically. If it's United, Humana, Aetna, each of these programs have great marketing material that enable you to be successful in the community as well. So you make your retail setting just the starting off point of your overall marketing efforts and the basis for your success moving forward, not only during AEP, but thereafter. When you go through and you visit all of these folks in the community, you keep a journal of who you visited with. So you can go back and visit with them more than once as well. It's the old water breaking down the stone type of approach. Or if they see you on a regular basis, they're more likely to do business with you. But you're also gathering that information so you can circle back to your market venue location, to your retail store and say, hey, these are some of the folks I visited with about your services. This is the flyer I'm using to help publicize your services. I want to help drive you business. Please make certain that your customers that come in when I'm not here know that I am available in your store on a regular basis and send them to me when appropriate. It's very important, too, that you follow the edicts that are laid out in one case, the Walmart campaign, where you're supposed to check in with the pharmacist before your shift and check out before you leave. It's a great way for them to know that, hey, Joe Smith is here. We need to send our folks there now. We've got his flyers off his kiosk. We need to make certain that people are aware of when he's in the store and when she is available to do the service that's necessary for them to look at and be comfortable with their choices for coverage moving forward. Some of the additional things we can help you with here at Premier to make this successful, well, if you're contracting with multiple carriers, the Assurance Bay program allows you to set up an agent profile and contract with multiple carriers electronically. You don't have some of the challenges then with, oop, I missed this initial. I didn't sign it here. Oh, they don't have my current E&O. All the different things that come out of an agent profile is there for you. It's also a way for you to pick up some of those ancillary programs very simply so you can do the add-on sale, the old Columbo. By the way, do you have dental coverage? By the way, are you comfortable with the dental coverage that comes as part of your program? Most people that need dental coverage aren't, so it gives you an opening for it. Here's some of the dental programs I have available. Oh, you go in the hospital multiple times a year, that daily co-payment within your Medicare Advantage program can be a challenge. Here's a way we can budget for that through a hospital indemnity program. Oh, your family has a history of cancer. Here's a program that can really help you with what is one of the expenses that can really push you to your maximum out of pocket with your Medicare Advantage program. And you do so by contracting with the appropriate carriers, utilizing your agent profile that you set up, Assurance Bay, and contracting electronically thereafter. And we also want to make certain that you are covered for that as well. So we offer discounted E&O that covers you regardless of who your upline is with the program that you're offering. You're an independent agent. Very few contract with just a singular organization. They have a contract here and there with other folks. This is a program that covers you regardless of who your upline is for that particular carrier. We also have a means for you to make certain that your license stays into play. That little requirement, right? Well, bundled continuing education programs through WebCE and our association with that organization make certain that you stay up to snuff at a reasonable rate as well in that area. And since you are an independent agent and you're responsible for your own benefit program, here's a way that you can actually pick up non-cancelable DI coverage on a modified guarantee issue basis where it's discounted in its rate and you share in the commission on those coverages. Great way to add to your own benefit program through an affiliation with our organization. We ran through a whole lot of different concepts when it comes to reaching out into the community and making certain that you are utilizing all the resources that are there just for your identification and taking. These webinars, as is this one, are recorded generally, and they're available either on our YouTube channel or on our website at premiersmi.com. Use them. They're available 24/7, and though generally you hear the dulcet tones of my voice, this, however, makes certain that you have the opportunity to go and review those approaches as well. We spoke of the opportunity of looking at different Medicare supplement programs. That is appropriate for much of the Medicare population as well. This access to the quoting and enrollment tool now through our organization, available without cost to contracted agents with Premier Marketing, gives you an opportunity to look at different categories of products and cross-sale as well. Many times in certain markets, you'll see one particular carrier dominate the Medicare Advantage space. Here in North Texas, there's one carrier that does it, and they have a very satisfied population of members as well. You don't necessarily want to disrupt something just to disrupt it. However, pulling up that information on that Medicare Advantage program enables you to make use of a program that fills the gaps. So it gives you an opportunity to cross-sell some additional hospital indemnity programs in order to fully cover that individual without having to change their coverages. And as we get into AEP, let's remember what happens with our commissions during AEP. We don't get paid until after the first of the year. Those hospital indemnity programs pay as issued. So in many circumstances, we can receive the funds that are coming to us within a 2-week period. We can bundle on some dental as long as we're at it in order to make certain that our prospect and client is fully covered. So you have those opportunities there for you. I spoke of the Medicare Center program. This is a software program that enables you to procure that scope of appointment electronically and store it electronically, and also enroll people remotely. You don't have to be sitting next to them. As long as they have an email address and some different technical expertise to a degree, they don't have to be tech savvy big per se, but it's a great way for you to follow up with an individual, not only during a selling season, but year over year. You can use this as a CRM and use it to offer annual reviews, not only for the folks that you sold, but the folks that didn't buy from you as well. And then, of course, we are adding additional e-apps into that quote engine that we mentioned just a bit ago as well for Medicare supplement programs. We also have a way for you to put your social media marketing efforts on autopilot. We're seeing a great deal of success in Facebook ads in different parts of the insurance world. This is a great way for you to have a company do that for you. We want to also make certain that you're fully compensated for all the work you're doing. And that includes taking advantage of the carrier incentives, not only additional bonus programs for appropriate products that qualify for it and that it's compliant with, but also qualifying not only for a carrier trip, but also our producers convention that this coming year is a cruise from Miami to the Bahamas. If you are a sun worshiper, this is one you really want to take advantage of. Additionally, we have some other lead programs that can be helpful for you. If you are a friend of Ma Bell and aren't afraid to cold call, we can create custom lists for you for products that is allowed in that area where it's compliant. It may not be just programs in a particular area. It may also be the state of residence where that might not be an option for you. But for those that are, we can make certain that that's available to you with a customized outlook for it to make certain it works. We speak of the different community-based programs with retail marketing programs such as what we're discussing today, but also approaches for the faith-based organizations and working with different providers. Some of the carriers during AEP, particularly in the Medicare space, have leads that they work with certain agents on, and that depends a lot on the relationship you have with that carrier. If you've never done any business with them and they go, hey, give me a lead, and they got a guy that busts his hump for them, who are they going to give that lead to? So it's a part of relationship building there as well. That internet program that I spoke of, we're actually just going through a pilot program with Facebook leads in the final expense world that has been very, very successful. We're about to roll that out into the Medicare space as well. So that's something to be aware of and watch for. And we do offer direct mail support as well. Based on production, we can substantially subsidize the cost of your mailing campaigns. So you can do that on a regular basis. Make it like your fitness program where you're doing it consistently so you see the benefit of it without just seeing a little bit of financial pain. All that said and done, we want to work with you in different scenarios. We want your business and we're asking for it right now. If retail is a key part of your marketing program and you don't have a location, we need to talk right away, because the locations are getting thinner and thinner, and in some cases aren't available with certain programs any longer. However, there are different things that we can do in order to take advantage of that concept. As long as we can put it into play, we don't procrastinate, we prepare for it, and we'll work through that initiative. You can reach any of us here at Premier Marketing through our toll-free number of 1-800-365-8208, or you can also reach us through our website at premiersmi.com. Watch for the follow-up to today's presentation. That includes some additional resource material that will plug into that email that might help with your marketing efforts in your particular area of expertise. We really want to make certain that we leverage all the opportunities that you have not only this AEP, but in the time period leading up to it. It's kind of scary when you're halfway through July and we're talking about 1/1 effectives and you don't get paid on those in most circumstances until after the first of the year. Unless you're independently wealthy, you got bills in the meantime. Let's make certain that our programs also properly affect the payment of those and are maintaining and reaching the goals that we have for ourselves, our agency, and our families. I want to thank you for the time you spent with us here today. I know the investment of that precious resource is paramount to your success. Thank you for putting some of that in with us here today. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so much. We'll talk to you soon.